Welcome to this essential discussion on Linozyfic, a significant advancement in the treatment landscape for relapsed or refractory multiple myeloma. This presentation is designed to provide comprehensive information for medical professionals, patients, and caregivers navigating this complex disease. Linozyfic, with the generic name linvoseltamab, is an innovative injection for intravenous use. It represents a new therapeutic option for adults battling relapsed or refractory multiple myeloma. This treatment is specifically indicated for patients who have undergone at least 4 prior lines of therapy. These prior treatments must include a proteasome inhibitor, an immunomodulatory agent, and an anti-CD38 monoclonal antibody. Linozyfic is administered as an intravenous infusion, typically once a week or once every 2 weeks, depending on the treatment phase. Linozyfic belongs to a novel class of drugs known as bispecific B-cell maturation antigen (BCMA) directed CD3 T-cell engagers. Its mechanism of action is highly targeted and precise. It acts as a molecular bridge connecting 2 critical components. The drug attaches to specific proteins, CD3 on the surface of T cells and the BCMA protein found on multiple myeloma cells. This unique connection brings the patient's own T cells into close proximity with the cancer cells. This engagement activates the T cells, empowering them to recognize and destroy the malignant myeloma cells. Linozyfic, linvoseltamab, received accelerated FDA approval on July 2, 2025, marking a pivotal moment for patients. This approval was based on compelling data from the Phase I-2 Linker MM1 clinical trial, NCT 037611108. The trial demonstrated impressive response rates and durability in heavily pretreated patients. At a 200 mg dose, linvoseltamab achieved a 71% overall response rate in this challenging patient population. Furthermore, at a 14-month follow-up, 50% of patients achieved a complete response or better. The median duration of response was a remarkable 29.4 months, highlighting its sustained efficacy. Linozyfic is administered as an intravenous infusion, following a carefully designed step-up dosing schedule. This approach is crucial for mitigating the risk and severity of cytokine release syndrome, CRS. Initial doses require specific infusion times and patient monitoring. For the first 3 step-up doses, Linozyfic should be infused over 4 hours. The second treatment dose can be infused over 1 hour. Subsequent doses may be infused over 30 minutes, optimizing patient convenience while maintaining safety. Hospitalization is required for 24 hours after the first and second step-up doses. This allows for close monitoring of patients for potential adverse reactions. Healthcare providers will also administer specific pretreatment medications before each dose. These pretreatment medications include acetaminophen or equivalent, diphenhydramine or equivalent, and dexamethasone or equivalent. Dexamethasone dosing varies, with 40 mg given before initial step-up and first full treatment doses. Once tolerated, the dexamethasone dose may be reduced to 10 mg. The detailed dosing schedule begins with a 5 mg step-up dose on day 1, followed by 25 mg on day 8. The first full treatment dose of 200 mg is given on day 15. Subsequent doses are 200 mg weekly from week 4 to week 13. From week 14, the dose becomes 200 mg every 2 weeks. For patients achieving and maintaining a very good partial response, VGPR, or better at or after week 24, and having received at least 17 doses, the frequency can be extended to 200 mg every 4 weeks. Like all potent therapies, Linozyfic can cause side effects. Common side effects include musculoskeletal pain, cytokine release syndrome, cough, upper respiratory tract infection, diarrhea, fatigue, pneumonia, nausea, headache, and shortness of breath. Patients should report any new or worsening symptoms to their healthcare provider. Linozyfic carries a boxed warning due to the risks of cytokine release syndrome, CRS, and neurologic toxicity, including immune effector cell-associated neurotoxicity syndrome, ICANS. These are serious, potentially life-threatening conditions that require immediate medical attention. Cytokine release syndrome, CRS, is an immune overreaction leading to widespread inflammation. Symptoms include fever, low blood pressure, trouble breathing, or vomiting. The step-up dosing strategy is designed to reduce the risk of CRS. Neurologic toxicity, including ICANS, occurred in 54% of patients in the Linker MN1 trial, with 8% experiencing grade 3 or 4 events. Symptoms can include lower levels of consciousness, confusion, memory loss, and coma. Patients must immediately report any such symptoms. Other serious side effects include infections, which can be severe or fatal. Patients should report signs of infection, like fever, chills, or shortness of breath. Neutropenia, a low white blood cell count, and liver toxicity are also potential concerns, requiring regular monitoring of blood counts and liver enzymes. Linozyfic may also harm an unborn baby. Females of childbearing potential must use effective contraception during treatment and for 3 months after the last dose. Patients should discuss all potential risks and benefits with their healthcare team. Due to the significant risks of CRS and neurologic toxicity, Linozyfic is available only through a restricted program called the Linozyfic REMS, Risk Evaluation and Mitigation Strategy. This program ensures that the benefits of the drug outweigh its risks. Patients will receive a Linozyfic patient wallet card, which should be shown to all healthcare providers. Pharmacies and healthcare settings dispensing Linozyfic must be certified through the REMS program. Prescribers must also be certified to ensure safe and appropriate use. Before receiving Linozyfic, it is crucial to inform your healthcare provider about all your medical problems. This includes any history of neurologic problems, lung or breathing issues, liver problems, or recent or active infections. A comprehensive medical history helps ensure patient safety. For women of childbearing potential, pregnancy testing may be conducted before starting treatment. Effective birth control is mandatory during treatment and for 3 months after the last dose. Patients should immediately inform their provider if they become pregnant. Breastfeeding is not recommended during treatment with Linozyfic and for 3 months after the last dose. This precaution helps prevent potential harm to the infant. Always discuss these important considerations with your healthcare team. Patients should also avoid driving or operating heavy machinery for 48 hours after completing each step-up dose. This restriction also applies if any neurological symptoms occur until symptoms fully resolve. This is a critical safety measure to prevent accidents.